Okay. Hello, Hallie.
Hi.
I have a few questions for you before we can get along to the paperwork about your job.
Sure.
So, my first question, go ahead and give me a little bit of history about your experiences and why you decided to work in the dental field.
So, I actually didn't decide to work in the dental field. My mom was going to a dentist and he was in need of somebody to work the front desk. And I guess she raved about me like she always does when she goes to the dentist. And he called me and said, I heard a lot about you and, come work for me. So I did. That's how I got into the dental field.
Okay. All right. Well, how do you feel about continuing your education in the dental field?
I love to do continuing education. I've done many different courses throughout my career and even gone to a hygiene course with one of the hygienists as well. I just always like to stay on top of all the new, and any type of CE credits for my certification would be great.
Okay. All right. Makes sense. Do you possess any administrative and organizational experiences?
Actually, I do. My previous job was not a dental assistant. I was hired to run the front desk. So I was in charge of scheduling and contacting patients and insurance filing and everything to do with front desk work at the dental office. So I obtained a lot of organizational little techniques.
Okay. How well do you perform under supervision?
I've had several office managers in the past throughout my dental career, so I would say I performed fairly well. I've also worked for some dental offices that the dentist was the one who did any kind of reprimands or meetings and such, so I think I do fine.
Okay. Are you capable of working with patients of all ages?
I am. I actually do. I don't know if I would say prefer is the right word, but I do love working with children. I know that there are some dentists that are fearful of working with little kids the older that they get, but I actually enjoy it. I like taking their mind off of actually being at the dental office. What it's like when you have to get an injection, and I ask them to wiggle their toes or lift their feet, and I don't know, just try to give them a great experience. So I would say I can work with any age.
Okay. How well do you respond to criticism?
I would say I respond fairly well, as long as it's positive and corrective. Feedback is fine. I rarely am ever on the defense about anything, especially at work. I'm always looking to change something or do something, better if there's a better way. So I'm very open.
Okay. What does teamwork mean to you?
So funny you should ask. Teamwork to me, went to a seminar one time and they gave out these pins and it had the word team on there, and it said, together everyone accomplishes more. And that's just kind of been my motto when I've been at work, and I feel everybody needs to help out everybody. We all seem to have a common goal. I mean, the goal is, of course, to take care of our patients, but it's also to get back home to our families. So we all want to get out of the office kind of in a timely manner. So it's nice to have others pitch in when needed.
Okay. On a scale of 1 to 10, how would you rate your listening skills?
I would rate my listening skills at about a 9.5. I've perfected them over the years, so I would say I'm a fairly good listener, especially when patients want to talk about previous experiences or how to get, past a fear. So I think you have to be an active listener in the dental field.
Okay. What would you say is your most valuable attribute that you can bring to our office?
I would say my smile. It's kind of hard to not smile back at somebody when they're constantly always smiling at you, or just to be happy at work. I find that it makes the day go better when everybody has a smile on their face, especially working in a dental office with teeth.
Right. So that'll conclude our interview. Do you have any questions for me?
I don't think so. I think you answered all the questions that I had prior to the interview, so I appreciate it.
All right, sounds good.
Okay, thanks.